Hello, everybody, and welcome. This is the Tenncare Reimbursement Update webinar by Healthcare Business Specialists. We want to thank our sponsors, Azalea Health and ChartSpan, for working with us to make this a free webinar so that everyone can enjoy the information that we provide. Today's date is February the 27th, 2020. My name is Mark Lynn. I'm a CPA from Chattanooga, Tennessee. I have worked in the Rural Health Clinic program for some 32 years now. There is my contact information if you need to get a hold of me. Dani Gilbert is also on the line. She works with us helping prepare cost reports and 855As and getting RHCs ready, getting clinics ready to become RHC certified. And there is her contact information, and you're welcome to contact her at any time, except for maybe when their 7, 8-month-old baby is sleeping. Probably that's a bad time, but contact anytime. Also, if you're not a member already of our Rural Health Clinic Information Exchange group, that is a Facebook group for everybody, so you can ask questions. We have over 1,050 members, and there's a lot of good information on there. A lot of people answering questions for people, and it works really well, so we appreciate that. We do, again, thank Azalea and ChartSpan. They are back sponsoring our free seminars this year as well. Right now, there is a schedule for November. We do plan on having a few more seminars, maybe in Georgia, Arkansas. We're sort of working on those, and those will be free as well and will be sponsored by Azalea Health and ChartSpan. If you guys are brand new to becoming a rural health clinic, we do have a Google Doc that we use to help people get started as RHCs, and there is the link to that as well. That will be very helpful. If you guys haven't become RHC status yet, you'll definitely want to look through that document. The disclaimer, everything is current as of today, as far as I know. Again, we'll be providing general information. We will not be giving specific advice on telling you what to do and what not to do. We do not own any RHCs. We do not bill Tenncare for any services. We do, for disclosure purposes, we do quarterly Tenncare wrap reports, and we do prepare RHC cost reports for our clients. And this session is being recorded. If you want to listen to it at a later date, you can do that, or you can share it with your staff if they need to. It will be posted on YouTube in the RHC Information Exchange Facebook group, and it will be on our website as well. And questions? If you have any questions, you can just type into the question box there, and Dani will slow me down at appropriate times to take those questions and ask those to me. And then this shouldn't be more than probably 35 minutes or so, hopefully, and we'll have a little bit of time for you to ask questions. We can open up the line and ask you a question. If you're like me, I sort of prefer just to type those in, and we can address those questions that you have as we go through here as well. So let's go back into a little bit of history here. Here's the timeline of what's happened in Tennessee to get everybody sort of on the same page. 10/1/2017, there was a moratorium on rural health clinics in Tennessee. It wasn't the normal moratorium where you couldn't become an RHC. You could become an RHC. It just, you ain't getting paid by Tenncare to be an RHC, which is sort of, I don't exactly know, of another entity that's ever said we're going to change the laws, and while we're thinking about what laws we're going to change, we're just going to stop paying you. That doesn't really seem like a very legal or logical way, but that's exactly what happened in Tennessee. And what happened is on 12/27/2018, the Tennessean published an article about what Tenncare was doing, and actually the article came about because the Tennessean published an article about an RHC that was stealing all this money from Tenncare. And when I read the article, it was really an FQHC. So I called the author immediately and said, hey, that wasn't a rural health clinic, that was a federally qualified health center. And so then we started talking, and then next thing you know, a couple of weeks later, this article comes out. She had worked it up from the information I'd provided Bill Finifrock's name and number, and a few other people that were caught up into this moratorium, And so that article was published, and it really had amazing results. It sort of went in a mini viral way around the larger cities in Tennessee, and I know there was one in Chattanooga that published the article. Johnson City, some of those cities actually published it, or people putting out their opinions. And January the 10th, amazingly fast, January 10th, 2019, Tenncare said they would start paying RHCs again. So that was amazing results. It's amazing what the media can do for you. So 1/10/2019, Tenncare RHCs started getting paid, those that were stuck in the moratorium. And what happened these 2 years, Tenncare was coming up with all these rules. They had about 19 or 20 pages of rules related to how they were going to set rates and how they were going to review cost reports and how were they going to disallow all these expenses, and how preparing a cost report was going to be much more complicated. It was going to give them all this information every single year. It was going to cost a lot of money to comply with these regulations. And they were supposed to go into effect on 4/25/2019, sometime around 4/13. I'm not exactly sure the exact date, but Tenncare withdrew all of those regulations, even though they were supposed to go into effect in less than 2 weeks. They were just pulled from the table, which was very, very thankful of that, because it would have been a nightmare. And then on September 26th, Tenncare announced that they had officially lifted the moratorium from rural health clinics. So even though, from my standpoint, it's like, okay, we can become an RHC, we can get paid as an RHC, it's the worst moratorium ever after January the 10th. It really didn't do anything. So that's sort of the history there. Here is the story there. I'm sorry, Alicia, you got your eyes closed in that picture that was in the Tennessean there. But there is the story there if you guys want to. And this PDF here is on the sidebar here in the handouts. All these are hot links. If you click on that, you'll actually go to that document there, so you can read the article that was in the Tennessean. Here is the moratorium letter that came out on January the 10th from Tenncare, indicating that they were going to start paying us. So that was good news. And then here's just a notice: October 1st, 2019, is the moratorium is being taken away. And if you click on this link, you'll actually go to the Tenncare website, and it shows you that the moratorium is being removed. Here is I copied and pasted some of the information from the website, and there's links to documents, a memo on the RHC moratorium, and an FAQ on it as well. We will go over the FAQ pretty closely. I copied and pasted a lot of the data from there, or the information from there. So we will go over that as we go through this webinar today. This is what the Tenncare website looks like, where I gather this information from. So if you get to some of those like this, you're at the right spot. And then a couple of things here. This is what the moratorium on final rate setting looks like. This was published September the 26th, 2019. So pretty fresh document. What we have done, Dani, Gilbert, and myself, and a physician went to meet Tenncare on February the 11th of this year to talk to them about some issues as far as his final PPS rate. And so at that time, we had a good opportunity to ask them some questions there. And so we put together a FAQ as well from the information that we got from the comptroller's office at that time. And so that FAQ will be sprinkled throughout this document, through this presentation as well. I'm going to put on their source HBS on there, so you know if it's coming from us. If it doesn't say that, then that's basically we've copied and pasted from the Tenncare document. And those will be much more official than ours. Ours is our interpretation of what they said. So, it could be hit or miss on that one. So Tenncare FAQs, this is what that FAQ will look like whenever you pull that document as well. There's only about 8 or 9 questions on there. It's a 2-pager, so it's not hard. And again, we will go through each one of these on an individual basis as we go through. There's the second page. It has 9 questions instead of 8, so it's not that much to it. Here is the document that we prepared. It's only 3 pages long. I did redact some of the information there because It was on telehealth. The original said that, and typically whenever I hear information, I run it by at least 3 sources before I put it in there. And during the meeting, we had the doctor was telling us that he was doing telemedicine and he was getting paid his RHC rate. The comptrollers, people that were there, their heads didn't spin around like it was, I don't know, from the Exorcist or whatever. And it looked like they agreed that you could do that. And then I looked at, there was a law that was actually published effective 10/1/2019 in Tennessee, which talked all about Tenncare and about parity and how Tenncare was gonna make parity for all the payments and everything. And I was like, well, it sounds to me like we are going to get telemedicine payments at the rate, because Alabama's already done it, Kentucky's already done it. Why not Tennessee? And then I got a call from a lawyer, and she told me, she said, what Tennessee means by parity isn't what everybody else means. What it means is you can do the service, but they're not going to pay you at the rate. And I was like, I know that. We've been down that road on the rural health clinic side already, so we know that game. So if you guys were planning on doing some telemedicine, I would probably don't be on the bleeding edge. Let's wait for a little while, make sure that somebody else can get paid their RHC rate till we actually see it. I should have asked the doctor to show me a remittance advice in that meeting, but so we want to pull back on that telemedicine piece, and I actually removed it from the document as well. So apologize for getting a little bit carried away. I'm excited about this telemedicine stuff. So let's go into the document itself here. This is the FAQ. Has the moratorium been lifted? Yes, effective October 1, 2019. What happened to the rules? They didn't really tell us. They just said that those proposed rules were withdrawn from Tenncare and will not take effect. So we can clap and hallelujah, they're not taking effect. So thank goodness. If you've not yet registered with Tenncare, go ahead and make sure that you register as a rural health clinic. You're going to have to fill out an EFT in order for you to start getting paid your quarterly checks from them. If you've already done that, then there's no reason to go through this process. But for the people that were caught up in the moratorium, this is the step that they need to take in order to start getting paid their quarterly payments. So there's 2 real buckets there. There's what we call the pre-moratorium. If that was October 1, 2017 is the date that I'm using. I'm not sure if it's technically correct, but I did look up, and there were no RHCs that were certified in October 2017. So whether it's officially 10/1/2017 or 11/1/2017, it doesn't really matter. None of you guys will be in that October 2017 bucket because nobody was certified during that month. So we'll just use October 1, 2017. We'll call you guys the green bucket, the pre-moratorium bucket, and you'll be treated a certain way. And if you're in the red bucket, you guys are what we call, I guess you're in the moratorium. The moratorium and going forward, that will be you guys that are red bucket. And that's the date you're certified as a rural health clinic. You should have a 1-page letter with what's called a CCN number on it. In Tennessee, it's typically going to be a 44 dash, and it'll have 4 more digits on it. We did have one in Tennessee the other day. I was looking at their provider number. It's like it started with an 88. Our CCN number started with an 88, but for the most part, they're going to be 44s in there. So we may have run out of CCN numbers. That may have been what happened to that particular clinic. So those are our 2 buckets. And what's the next thing on our bucket here? Interim rate setting. If you were prior to 10/1/2017, what we did is we or your cost report person filled out a cost report. We submitted it to Tenncare. They reviewed it, and they would set your rate based upon your projected cost per visit. Starting 10/1/2017, Tenncare is using your grand divisions, your East, Middle, and West Tennessee, and they have an interim rate for each one of those, and they will start paying you that rate. And so here are the rates. This is a document that we prepared on 2/12/2020 after our meeting with the comptroller's office here. And what they told us was the interim rates will remain the same as the January 2019 memorandum that came out. So you guys going forward, if you become a new rural health clinic, this is what you guys are going to get. In West Tennessee, $141.49 will be your interim rate. Middle, $131.35, and in East Tennessee, $137.39. That will be your pay. Doesn't matter what your cost is, doesn't matter what your visits are. Your beginning interim rate will be one of these three numbers, depending on where you are located in the state. Here is the map of the Grand Divisions, and you just want to be very careful if you're in one of the counties that are right on the edge. I know I had one yesterday where we had a clinic that was moving from Putnam County to Crossville to Cumberland County, and they went from Middle to East Tennessee. And so we talked to the state this morning, and they said, yeah, they would pay them the East Tennessee interim rate going forward. So that was great. So if you're a new clinic entering into the after the moratorium has been lifted, what is your rate? This is what Tenncare, they write things where you can't understand them. This was from the memorandum in January 2019, but what the bottom line is, you're going to get these rates after talking to the comptroller's office on February the 11th here. So those are the rates. We've talked about those. You know what those are going to be. Okay. What about, so your interim rates, you know what you're going to get for you guys that started in after 10/1/2017. What about settling up? What about your final rate setting process? So you guys that were prior to the moratorium, it's going to be based upon your cost report. That's the only way you're going to get your money. There's these regionally adjusted PPS rates that I'm going to show you in a minute, do not apply to you guys. So don't go into the meeting with those saying, well, this rate's 140, 174.40, 99. I want to get that. It doesn't work that way, unfortunately. You don't get that rate. So if you guys were in the moratorium, then there are things that's called regionally adjusted rates, and you can you may, depending on how many visits you have, you could get paid that rate. If you have more than 14,000 visits, you're going to have to fill out a cost report, a base year cost report, and you'll be paid upon that. When you fill out your base year cost report, and if you're less than 14,000 visits, if that rate is higher on that cost report than what these regionally adjusted PPS rates are, then you're going to ask them to do an APM, an alternative payment method, and use the cost report, because you will get more money that way. So it's really nice in a way, and then we have some pretty good baselines for RHCs to get. We know we're going to get at least the regionally adjusted PPS rate if we have less than 14,000 visits. So let's go on to the next slide here. Again, these regionally adjusted PPS rates do not apply to RHCs who were certified before 2017. And then here's this is a document from Tenncare. I'm not going to go over it because they talk in their sort of gobbledygook language, but I'll make it the simple. This is us. This is the way we say exactly what they just said there. So how will your PPS rate be established? The first full year cost report that the RHC is in the program. So if you were surveyed today, 2/22/2020, and you had a 12/31 year end, your base year would be your first full year in the program. That would be 2021. So you have to have a full 12 months in the year in order for that to be your base year. So keep that in mind. So they're going to use your base year cost report, and they're going to count the number of visits here. And so again, clinics with less than 14,000 visits, there's a schedule. I'm going to show you the next on the next page. I'll show you the schedule. If you have 14,000 or more, you're going to use the cost report for that. So let's look at that. Let's look at the schedule here. Here's your regionally adjusted average PPS rates. East Tennessee, if you're less than 8,000 visits, you're going to get and I'm using fiscal year 2020 now, $174.44 a visit. That will be your final rate, which is really awesome. And then if you're 8,000 to less than 14,000, you're going to get $129.21. That's a big, that is a big difference between 174 and 129. I mean, what's the scary part is going to be is if you're running 7,990 visits at the end of the fiscal year, you know, that's a difference of $50-something or $50 on your rate if you go to 8,001. So, you know, I mean, I'm not going to say anything, but I'd be taking vacation the last 2 weeks. I'd be closing down the clinic to keep us at 7,990. I didn't say that, but that's what I would do. But and then Middle Tennessee, here's our rates here: 143.61 is less than 8,000. And if you go over the 8,000 to 14,000, 158.26. And if again, you're going to want to try to get to over 8,000 there. Again, these reimbursement methods that they provide, they basically incentivize you to do certain things. I know the government doesn't like for me to say that, but the tax law incentivizes us to give to charity, it incentivizes us to buy equipment at the end of the year. These regulations incentivize us to do to act in certain ways. And so this is what, in this case here, if you went to 8,001, you're going to get 15 more dollars per visit. None of this is really super logical, but this is the system that we have. In West Tennessee, if you have less than 8,000 visits, it's 149.47. And if you have between 8,000 and 14,000, your rate is 136.47. Again, all these, you can see there's no rates established for more than 14,000 visits. So those will all be used in cost report. So if you have a large clinic, you're going to have to use your cost report in order to establish your final rate. So here's the strange things that happen whenever you get it, whenever you have these rates, is East Tennessee, if you're less than 8,000, your interim rate is 137.99. Your final rate will be 174.44. You will actually get paid that variance, that $36.45, whenever Tenncare gets around to reconciling with you. You're going to get a check for $36.45 for every Tenncare visit that you've had that's been reconciled up until that period of time. So that's a great thing. So if you're in West Tennessee, Middle Tennessee, you will always actually receive a settlement here. So Middle Tennessee, you start at 131.35. Your final rate will be 143.61 if you're less than 8,000. So you get $12 more for that. And then coming down here to 8,000 to 13,999, you're going to go from 131.35 to 158.26. So Middle Tennessee, if you're 13,999 visits or below, you're gonna get some money on your reconciliation. In East and West Tennessee, you may actually have to pay money back to Tenncare. See the little negatives here? If you're between 8,000 and 13,999 visits, your interim rate is going to be 137.99, and your final rate will be 129.21. You're going to lose $8.78, and Tenncare is going to recoup that money. Again, doesn't really make a whole lot of logical sense to me the way they're doing that, but that's the way this little table works out. In West Tennessee, you'll be paying back $5.02. If you have less than 8,000 visits, you will always be receiving a settlement too, a final settlement as well. So that is a good thing. Dani, I see the little question mark thing over there. Is there any questions that we can address now, or should we hold them to the end?
No, this is a good one to ask. There's only one in there. It says, although we are already set, I want to ask on the visit count, is that all patient visits or just Medicaid patients?
All visits. That's a good question. It's total visits. So it's Tenncare, Medicare, self-pay, no pay, the cost report. What you do is you take your total expenses divided by your total visits. And and I should have made that clear. That is a good question. Okay. So Dani, is that the only question we had?
Yeah, we've got Mary Rhodes with her hand up, but she doesn't have a microphone, so I don't know if she accidentally hit it or not, but that's the only question in the queue.
Okay, all right, good deal then. All right, good. That's an excellent question. All right, let's move on there. So you see what the originally adjusted rates are and how the settlement works for you guys here. So here's the settlement process. And this was good news for you guys in the green bucket, the ones that were prior to 10/1/2017, if your final rate is lower, there will be no recoupment in applying your final rate. So what that means is, I know when we had the meeting with the comptroller's office the other day, our our rate was 140. Our actual cost per visit came in at 106. It was a very, oh, the clinic was so busy, and so their final rate came in at 106, and so they would have actually had to pay back probably close to $1 million to Tenncare if they were making them pay back. So they did not have to pay that money back. So that is great. So if your rate, if the final base year, final PPS rate is less than what your interim rate was, you will not have to pay that back if you were prior to 10/1/2017. Also, if the final rate is higher than the interim rate, then you will get a settlement for you guys that are in the green bucket, the pre-moratorium clinics. If you are caught up in the moratorium, then there will be settlements. They'll settle you. If you come up short, you're going to have to pay money back. If your cost per visit, if your final PPS rate is more, then you will get that money as well. So in the green bucket, you're not going to have to pay money back. In the red bucket, you're always going to have a settlement, either plus or minus for that. So, okay. And pay up. Here we go. So what happens, and here's one of the questions that we ask when we're at the meeting with the comptroller's office: will my RHC rate change if my total visit counts go up or down in subsequent after the base year is set? Because that is a good question. Is, well, what if my visits go from 7,999 to 8,020? Now I'm in a new bucket. Will that change my rate at all? And the answer is no, it will not. They will look at that one base year, and that will be your regionally adjusted rate going forward, your PPS rate going forward. You will get the Medicare Economic Index increase every July 1st. So that sort of process would not change. So you'll get a 2%, sometimes a 1.5%. Sometimes I've seen it a long time ago be as much as a 3% increase, but it's not a big increase. But that's what your increase will be based upon. And only that base year cost report is the only one that counts towards those visits or counts towards your cost per visit, or your cost report cost per visit. So, and then will there be a reconciliation between RHC and Tenncare to settle the difference in my interim and PPS rate? And the answer is absolutely yes. We just told you that, and that's from our FAQ. So take that with a grain of salt. That's the way we understood what they said. And Dani, you were in the meetings like I was. You can correct me if I'm wrong on some of this stuff, because you know me, I get, at my old age, sometimes I get a little confused on Tenncare and all my little buckets that I have. Okay, let's next question here. I received an interim rate prior to the moratorium. When will I get my final rate, and how will the final rate be set? And the comptroller has been setting those rates. They're going to be based upon the cost report. Karen has been very good about sending out letters asking for information, and they've been working very diligently to get those caught up. So we've seen a lot coming in. We're going to show you some of the adjustments that they're making on cost reports. One of the reasons why we went from 140 down to $106 per visit. We'll show you what happened there as well. But they're working on those right now to answer that question. And that was from the comptroller's office there. What if my final rate is lower than my interim rate? And thank goodness we do not have to pay back that $1 million. Tenncare will not execute a reconciliation of the final rate if it's lower than the rate. That means no recoupment. So you can all breathe easy. We're not going to have to pay back Tenncare any money. So that is good. What if my rate is higher than the interim rate? What I just told you was you would get that money. So you get that money, and they will actually go back to the date that you became certified as a rural health clinic if you're caught up in the moratorium. You may not have gotten registered with Tenncare as a provider. That's okay. They were not letting people. The moratorium, they were applying to people trying to get into the Tenncare program to get paid. They weren't letting people register that way. But once that moratorium was relieved, or once they start making these payments now, you will go back to the date you were certified as a rural health clinic. So that one-page letter I told you about, where you get your CCN number, it has a date you were certified. That is the date that they will go back to and settle up with you on that. What if you're unhappy with your final PPS rate? There is an informal reconsideration process, and we're going through that on the one that we have right now. And Tenncare and the comptroller will come together. We have to submit to them reasons and adjustments and evidence of why we think it should be different than what it is. And so there is an informal reconsideration process that I don't think it's on the books anywhere, but they're very nice about doing that. Here are some of the adjustments that Tenncare has been doing on cost reports that we've been seeing. And first one is there is an allowable administrative compensation range. So if you have 2,100 visits and under, they will allow you to pay an administrative compensation for either an owner or relatives for up to, and this is for one FTE. 52,000 would be the base salary that they would allow if you're 2,100 visits and lower. And if you have 2,101 visits through 22,900, they will allow you $2.50 per visit up to the maximum of $104,000. So if you're paying your relatives a salary to be the administrator, if it goes over over these numbers here, then Tenncare is going to disallow that on your base year cost report as an allowable expense. Next item is if they're setting these base rates back in time, 2000 to a 2016, 2015, 2014, 2013 cost report, they are not adjusting them for inflation going forward. So the first thing we said, well, wait a minute, you can't, you're setting our rate in 2016 at 105, but there's been 3 or 4 years. We need to get at least our Medicare Economic Index increase for the last 4 years and do it using compounded interest on there, and to at least get that right. So that's one of the things I've started noticing on the ones that I've seen come in, like, hey, you guys aren't giving us credit for inflation factors for the last 4 or 5 years. So when you're fighting them, that is something that we've been arguing about as well. Here is a big one, is they're using, and this is what hurt us on the clinic that was so busy, was they're using a physician owner compensation. This was actually published on July the 21st, 2017, actually 7 months after the cost report that I filed that I'm arguing about. And they looked it up, that CMS put out these regulations about reasonable compensation. So this case here for our region, RHC Region 3, the rate was $304,655 was the maximum that they would allow on the cost report according to Medicare. And according to our calculations, the FTEs were basically 1.09, there were 1.09 FTE every year. So they allowed us $332,000 of reasonable compensation. So if you do have some highly compensated physicians, and we do see some that get paid more than this, they will be disallowed. The difference between the 332 and what they were actually paid, let's say if they were paid $500,000, then we're going to lose 168,000 of allowable expense. And if you multiply that by 4 or 5 doctors in there, that is a huge, it really hurts when they do that. Okay. Here's what that schedule looks like, the physician owner compensation schedule. You notice it only goes through 2014, so you have to put an inflation factor to get it up to the actual cost report that you're using. And then we're over here trying to think, let's see, south, where is it? Dani, can you see, where's Tennessee on here? Okay, we're East South Central Division here. So we're in 6 here. So Division 6. And you can see here in 2014, the maximum was $294,555 was the allowable salary. And that's the maximum. And then you just multiply that out. You just do the inflation factor like we talked about earlier and try to get up a little bit higher. Okay. Nurse practitioners, here's what we have seen them use was 105,620 was the allowable compensation for a nurse practitioner, which seems really, really low to me. I know the nurse practitioner that I've seen, they tend to make more than that. And they did allow an administrative compensation piece to that. They gave her a half an FTE and added $31,320 to that. So they gave her allowable 136,940, which is not bad in the long run. It's just that 105,620 number sort of rubs me a little bit the wrong way. I think that number is a little bit low for the nurse practitioners that I've seen. Consulting fees, they limit them to between $15,000 and $43,750, and so which, I mean, that's a lot more than I don't think we've ever charged anybody anywhere near that. So they ain't talking about us, but so that is one thing. So if you do pay, if you've got a high price consultant, you're going to get some cost disallowed from that. Thank goodness we're cheap. And if you're leasing an automobile, they're going to remove that automobile lease from the cost report as well. Okay, and that's all the adjustments that we had. There weren't really too many. The one that hurt us was that physician compensation piece that just killed us. Who do you call about rates, Karen? Dani, how do you say Karen's last name? I never can remember.
I think it's Deggs.
Deggs, Karen Deggs. She's super nice. Like I said, Dani and I met with them, her and Julie Rogers, and they were just super nice. So wonderful people. That was actually my first job out of college, was working for the comptroller's office, auditing hospitals and nursing homes back in the day. And it's the good old cubicle. I can remember it well. And so so you can get a hold of Karen. She's very, very helpful and gets back to you very quickly. Here are some of our resources that are on our website as well. There's the Tenncare article, all the memorandums are on there as well. And let's see here. There's Karen's information on how to get a hold of her if you need to, and questions and comments. Thank you guys for being here. That really wasn't too awful painful. 36 minutes. That was not too bad. Dani, do we have some questions on here? Or if you would like to ask, if you want us to open up the line, let us know and we will open up the line. You can ask your question.
There's one. The numbers that you gave, like for the visits, they want to know, is it quarterly or annual numbers?
Annual numbers, annual. Yeah, your base year cost report will be a 1 year snapshot. And so it's your total visits for 1 year is what we're looking at. But that's a really good question. Okay.
And that is all I have. It looks like Ashley Porter has her hand up, but she hasn't entered her PIN to be able to talk. So Ashley, I just say, oh, she typed it in. Okay. Has there been any discussion on appeals for existing RHCs to have a revised rate?
Okay, that wouldn't say it one more time, Dani.
Has there been any discussion on appeals for existing RHCs to have a revised rate? So to get a new rate.
Yeah, that was the informal review that I talked about that earlier. Was you have to, where is that slide? There's an informal review process. I don't think there's not a whole lot about it. If I'm unhappy with your PPS rate, there's an informal reconsideration process that's conducted by Tenncare and the comptroller. They basically give you 30 days.
Hey, Mark.
Yeah.
This is somebody who, I guess she makes it sound as if they've already had their final PPS rate for like an older clinic.
Oh yeah, no. Oh yeah, the only thing you can do there is a scope of practice, where if your scope of practice can change. If it's changed since that time, you could do that. Or there are other things you could do. If you'll email me, I could probably tell you some secrets, but I'm not gonna say them on here. Anything else? I'm not good.
Lyndon has his hand up, but he doesn't look like he has a microphone. Okay. So Lyndon, if you want to type your question in, I can read it. Another question came in while I'm waiting on that. How soon can we expect our final rate to be set, and how long after that until we get paid for the difference?
I don't know, Dani. What do you think about that one?
That I honestly don't know. I know we've gotten a ton of requests to get their final rate set on some of the clinics that we have,
Yeah.
There's not like a timeline out there that they've said how long it would take once they do that to pay the difference even.
Yeah. Yeah. We're just now starting to see these final PPS rates come in, and I've only seen probably 4 or 5 in the last month or so. So if you do get them, make sure you send them to us so we can review them, because like I said, a lot of them have these adjustments in them for things like physician compensation or nurse practitioner compensation. And if you do get your money, let us know so we can know when people are getting their settlements, because again, a lot of times the government will tell you one thing and do another. We've seen enough of that over the last couple years to find out that happens. Okay. Any other questions?
No,
we get
that's all I got so far.
question typed in? Okay. And was there one of them that I need to open up the line for somebody?
No, all the ones. Oh, Lyndon just typed in. It says, please go over the visits again. Total visits equals Medicare plus Tenncare plus self-pay and commercial insurance. And
What
then they
that means-
average what you were paid on all of the above.
Yeah. What I mean by total visits is face-to-face encounters between physicians, nurse practitioners, and PAs where a medically necessary service is provided that is within the scope of practice for that particular provider. That's the definition of a rural health clinic visit. There's a couple of things on there that will count as well, like TCM, for some certain preventive visits will count as well. And basically, it's your total visits. It's really, we could care less whether it's Medicare, Medicaid, self-pay, or no pay. It's those face-to-face encounters. Whenever we prepare a cost report, what we do is we get a CPT frequency report by provider, and we count those. And the reason why I went by provider is because there's productivity screens on physicians and nurse practitioners and PAs. So we have to have that information for the cost report. So total visits for a 1-year period of time. Okay.
And Lyndon, I also see where you asked me to open up the line, but it says that you're not connected to audio. So I'm not able to open it up on you.
Lynn, you can just call us. You know how to get a hold of us, so you can call us at any time. We'll be glad to answer your questions after this. Okay. All right. Any more? I see Ashley Porter. Have we taken care of that one, Dani?
She typed in a question. I assumed that it was the one that she typed in.
Okay. All right. Well, if you do have any questions that we couldn't answer here, then just call us, text us, email us. We'll be happy to help you on that as well. Thank you guys for your attention today. We appreciate it. This is being recorded, so we will put this out on our Facebook page and all the different places where you find us. We'll put that out there. Thank you very much. We appreciate it. And Dani, thank you for your help. We will close out the webinar. Thank you.